You are live.
Hello, everyone, and welcome back to Tuesday Tips, the first Tuesday Tips of 2025 after the break. So I hope everyone had an amazing time during the holidays. We took a little bit of time off, enjoyed with family, friends, loved ones. But 2025 started, so let's get to it. So today we are going to focus on preparation for surgery. So if you're thinking about or you're already scheduled for surgery in 2025, what are the things that you should focus on, okay? And I'm going to start for like very basic on the planning of surgery, like how to look for your surgeon. A lot of people say do your research, but how do I do or how do I know that I'm doing correct research or that I'm not wasting my time? What are the things that I need to focus on when I'm choosing a surgeon? So for me, the most important one is the board certification. The board certification status tells you that your surgeon did a complete training in plastic surgery. Unfortunately, laws here in the United States don't limit, and not only in the United States, this is a problem that we're seeing worldwide in a lot of countries, is that there is not a legal obligation to do a training for you to do a cosmetic surgery or procedure. So in reality, any doctor that holds a medical license, especially here in the state of Florida, can do a cosmetic or plastic surgery procedure. But I always tell my patients, if you're gonna have brain surgery, would you want a pediatrician to do your brain surgery? No, you want a neurosurgeon to do your brain surgery, right? If you're having your appendix removed, do you want an orthopedic surgeon removing your appendix? No, you want a general surgeon to do that procedure. So it's the same thing, right? If you want to have your heart checked, you go to a cardiologist. And this relies on two main things, the training and the expertise. And even though we all go to medical school, we all divide to our fields. And if you don't get the adequate training, you're putting yourself at risk. And that's the reality. Cosmetic surgery is surgery. So it does have risk involved and your life is on the line. So you need someone that took the time and trained in this specifically, went through all the rigorous training, certification, exams, and has all of this backing up the decisions that they make every day, okay? So I am a double board certified plastic surgeon. What does that mean? That I completed a general surgery residency, which is 5 years of surgical training in every specialty in general surgery. And then I completed a 3 years of plastic surgery residency, specifically only 3 years of just plastic surgery, okay? In between these two residencies, I did a fellowship in a burn and reconstructive fellowship in New York. So I did additional training in plastic and reconstructive surgery during this year, focusing on wounds and wound management, which helps me a lot guiding my patients that have unfortunately complications of wounds, which is very common in plastic surgery. The wound complications is actually the most common complication after plastic surgery, having an open wound. So having a surgeon that did adequate training is the most important part. The other part that people don't talk a lot about is that you connect with your surgeon. When you're choosing your plastic surgeon, it has to be someone that you feel comfortable with. Not only because you're going to show that person your body and talk to this person about what are your biggest fears, your anxieties, what you want in your body, but also if things don't go the right way, you need to trust your surgeon and develop that doctor-patient relationship, that you establish that bond that can take you throughout the entire recovery period. And that's extremely important, and that is why it's so important that you meet your surgeon before your surgery. Meeting your surgeon day of surgery, when it's marking you and going in, it's not adequate consultation and evaluation, and not a good evaluation and a good starting of that relationship. So I see all my patients the day before, so you don't have that stress that it's day of surgery and I'm seeing you and I'm marking you and we're going in. No, I see you the day before, and I see, of course, your case, your evaluation before you come in. So when you come in person to meet me, I already know all of your history, your pictures, why we're doing this procedure throughout this process, okay? So you want to look for a surgeon that does this, that has training experience, but also that the evaluation and in the pre-op and the post-op process, you continue this relationship with your surgeon, and it's not that you see them the day of marking surgery and then you don't never see them again. That is not a good doctor-patient relationship, okay? The other thing is, where do they do surgery? Because they can be board certified in plastic surgery and have experience, but then they work in a place that it's not certified, or it doesn't have good infection control standards, or that is a high volume place and you don't see your surgeon before or after surgery. So here at Pure, we are JCO certified, which is the same. The Joint Commission is the one that certifies the hospitals. We are an office-based surgical facility in the state of Florida, so I don't operate in a hospital. I have privileges in hospitals nearby, just in case, and 3 hospitals nearby, just in case anything happens, but I operate here. And this facility is certified by JCO, which is a Joint Commission. So that tells you that we have the higher standards of patient safety, infection control, and everything like an operating room in a hospital, okay? So these are good things to ask about the facility that you choose. What are the certifications that they hold? What are their infection control parameters and all that? So you get a little bit more of a better sense on where you're having your surgery, not only who is doing your surgery, but where you're having your surgery, okay? So after choosing your surgeon, you have all those questions answered, you're set, you're doing your surgery with Dr. Vidal at Pure Plastic Surgery. So how do I get a consultation then, okay? Very easy. You go to our website, pureplasticsurgery.com. I put it right here. It's very easy. If you open our website, there's going to be a link for virtual consultation. Si quieres hacerlo en español, hay un link para ponerlo en español y todo se va a poner en español y puedes hacer la consulta todo a través de español. Todos aquí en nuestra oficina, desde el front desk hasta las de ventas, el preoperatorio, postoperatorio, tenemos personas que hablan español durante todo el proceso. El community manager habla español. So, si le prefieren que todo el proceso sea en español, también esa es una opción. So you go there, the virtual consultation. I have a lot of patients that are like, but I'm local, or I prefer to see you during my consultation. You still do this process first, so I can evaluate your case and determine if you're a good candidate, okay? One of the things that I ask you during this process, what surgery you're interested in, your medical history, age, medical history regarding any conditions, medications, surgeries you've had, and I ask you for 3 pictures. The pictures are so important. These pictures are gonna help me assess the area that you want. So if you're interested in the tummy tuck, I want to see the entire belly, okay? If you send me a picture of your front with a bathing suit that covers the entire belly, then I can't assess that, right? So you want good lighting, you want to be a good distance. The angle of the camera, so if I'm evaluating the belly, the camera should be at the belly level, okay? If you're evaluating the breast, it should be at the level of the breast. And if you're evaluating the face, at the level of the face. The angle of the camera changes a lot the perspective and the perception of the picture. So that's very important. And the lighting, okay? So if you have windows, open those up. I want to see good lighting in the pictures. And at least 3 views, so one front. If it's the torso, you should be with the arms on your side like this, okay? Arms here may obstruct the view. Arms up, change also the perception of the belly. Angles like this. Selfies are no. Selfies I can't really evaluate, especially when you're going like this, the angle, everything changes. So either put a timer on your phone and put it in a so if you don't want someone seeing you naked and taking those pictures, put it a timer and put it in a table just in front of you, at least like 5 feet away, so you have good distance from the camera and just a good line in front, side, like an angle, 45 angle, and then a side view like 90 degree. At least those 3, so I can have different angles of the area, okay? Same thing for the breast, the face, or any area that you want to evaluate. When I get that information, I get those pictures, I get your medical history, age, and all that, I can determine if you're a good candidate for the procedure or not. This speeds up a lot of the process. If you then want to come in for a consultation, then we're prepared to have the consultation focus on the area that you want. Maybe you say, oh, I want liposuction, and I'm going to see those pictures, and I'm going to recommend, I think it's better that you think about a tummy tuck. And that way, we can have that pre-talk before you come in person, and stuff like that, right? So this virtual consultation part is extremely important to get that information and guide you in the correct way. There are patients that at that time, they're good to book. You can book at that time. There are patients that want to actually have a virtual talk with me. That's also a possibility. Others that want to come in person before. That's also a possibility. So your coordinator will give you a call after I do the evaluation to let you know all these options, and then you decide what's best for you. So after you book your date, or let's say, when should I book my date? So timing, when. So if I'm thinking that I want surgery this year, when should I have the surgery? Several things are important to consider when you're choosing a date of surgery. One is you have to have time off, okay? This is surgery, so there are patients that are like, oh, I'm going to be back at work in 2 days. It's fine. I'm a strong cookie. I can do it. You need time to heal and recover, so you need to take time off of work, okay? If you're traveling from out of Miami, I'm going to ask you to be in Miami for at least a week, and in that time, you need someone with you. If you have kids, for example, you need help with your kids who are going to take the kids to school, move them around. If they're babies, you need help because you can't lift them. So all of those things are important when choosing when is the right time for you to have surgery, okay? If you're thinking about that you have an event, let's say I have a wedding in June, when should I have surgery? At least 3 months before, okay? That surgery period can take up to 3 months, okay? Things can happen, swelling can be prolonged, you can have open wounds, and we don't want you stressing about such a special day when you're recovering and healing from surgery, okay? So at least 3, if you can do 6 months, even better, okay? Before that big event. And then remember, for work, at least 2 to 3 weeks, depending on the procedure you're having, especially if it's a tummy tuck that you're having drains. Try to get at least 3 weeks out, because drains most of the time stay for 2 to 3 weeks after a tummy tuck, okay? If you're thinking that you want to be summer ready, then you should be booking for earlier in the year. Same thing, 3 to 6 months before when you want to be ready. If you have a big vacation that you want to be ready for, that's in July, then you should be booking for surgery soon, like now. So you have surgery February, March, you know, and you're fully recovered by July. So that's like the planning, or like the way that you should be kind of spacing things around. So when to book if I want to have surgery in March? Now. So you want at least 1 to 2 months before the surgery, okay? Because what are the things that you're going to have to gather before your surgery? You're going to have to go to your primary care physician, get a clearance. You're going to have to get labs. EKG, if you're over 40, a chest x-ray. If you're having a breast procedure, you're over 40, a mammogram. All of those appointments take time. So if you want to have surgery next week, you're not going to be able to, because we ask for all of this paperwork to be submitted at least 4 to 2 weeks before your surgery so we can evaluate. I go over all of this paperwork after your clearance is done by your primary care, your blood work, and all of it. I check that everything is online, then we pass it to anesthesia. Anesthesia checks everything and they clear it. And in this process, sometimes things come up. Your hemoglobin may not be up to the level that it is, and we recommend iron infusions or other treatments. Blood work may not be to a par. We may ask you for extra clearances like cardiology and other things, okay? So it is important to do it with time so you're not stressed, and especially if you need specialists like cardiology clearance, neuro clearance, depending on your medical conditions, then those take even more time because they're usually very booked ahead of time, okay? So if you're surgery planning, it's best to do at least 3 months of surgery date. and then at least 3 to 6 months before when you want to be ready for whatever event you have, okay? So keep that in mind, because this is very important when you're planning on surgery, okay? And what to do before the surgery. I talked a little bit about the clearance process that we will go in detail after you book. The pre-op department gives you a call to go over in details about that process, but also very important, your caretaker, travel arrangements, staying in Miami for at least a week, all of those things are important. If you're having a mind makeover, lipo procedures, coordinating your massages are extremely important. Massages are essential for your post-op and recovery, so those should be booked in advance so you have it ready for post-op day 1, which is when you should be receiving your first massage, okay? There is a lot to talk about that planning before surgery, so I try to focus this one in kind of before, but we can definitely, if there are more questions about this, I can definitely do a live focus on just like the before the surgery, okay? I'll take some questions now if you guys have.
Yes, we have.
Yeah.
But let me start with a few nice comments we got on TikTok. Morenita número 1 dice, a 21 días de mi cirugía estoy llamando mis resultados.
Ay, qué bueno, me alegro mucho y se va a poner mucho mejor. Deja que la inflamación siga bajando y todo va a ir mejorando.
Ok, My Beauty Secrets Jax dice, best doctor ever. Las cicatrices son finitas y lindas. Yo amo mis resultados.
Súper, qué bueno, qué bueno. Yo tomo mucho tiempo en el cierre de las heridas, eso es sumamente importante, y también el periodo postoperatorio es súper importante para mantener esas heridas así que se queden como una linecita y que te puedas poner el bikini más pequeñito que tú quieras para que se pongan bien.
Okay, TikTok está on fire, seguimos aquí. Comprobado. Pure Plastic Surgery vale cada centavo.
Ay, gracias.
Otra paciente.
Qué bueno, me alegro mucho.
Ok, vamos ahora a cambiar de plataforma. Estamos en TikTok. Aquí te mandan saludos, doctora Vidal. A ver, ya estoy llegando. Es que no carga las preguntas de Instagram, no las está cargando. But we have a patient very special, natural newbie, Jessica.
Yes,
She's now connected, and she said, very beautiful, doctor.
Thank you so much. Hope you're feeling better.
Okay. Once I start the booking process, when I should have surgery?
So this goes back to the timing, right? So when you do the virtual consultation, you get a quote. So you do the virtual consultation, I evaluate it, your coordinator will give you a call. Once she gives you a quote, if you decide to book, that quote or that booking you can book for 1 year, okay? So for example, I did your evaluation today, January 7, 2025. Your surgery date can be until January 7 of 2026. So you have 1 year to put it, so you have like that time frame to book your date of surgery, okay? And then that's why I say once you want to book, at least, it should be at least 1 month from when you decide to do the consultation, okay?
How hard is the recovery process for a breast augmentation? I want 400 cc's.
Okay, so the recovery is not that bad for breast augmentation only. The size, you can definitely go over your measurements and see if that size actually fits you well. But a 400 cc implant is something that it's on the range of the common breast augmentation sizes that we can do, but it all depends, of course, on your anatomy and your measurements. And definitely something that is very doable. You're gonna feel tense. You're gonna feel that pressure feeling of the implant expanding your tissues. But that's really the first week or two. Majority of patients are really back to work and doing their daily things by 2 weeks. But I'm going to ask you not to exercise or heavy lift anything heavier than 10 pounds for at least 6 weeks.
Okay, this patient, she's from New Jersey and asks when she can travel back after a thigh lift surgery. She's planning to do it this year.
Awesome, good question. At least same as the mommy makeover, BBL surgeries, at least 1 week here, because I see you the day before of surgery, and then I see you post-op day 5 here in the office. With thigh lifts, I put drains, so you're gonna have 1 drain on each side. Depends on how much the output or how much the fluid is coming out on the drains. Sometimes we're able to remove them or one of them at the post-op day 5, but you may be traveling back home with drains. If you want, and I have patients that are like, I want to be sure that I don't travel back, the option is that you stay in Miami for at least 2 to 3 weeks, but it's not necessary. It's a personal preference. After post-op day 5, when you come in person, if everything is good, you're clear to travel back home.
Tengo 5 meses de mi cirugía. Hacía más de 17 años que no me ponía un traje de baño. Y me pude poner uno ayer en Puerto Rico.
¡Ah, me encanta!
¡Tu paciente! ¡Yeah!
Me encanta eso. Qué rico. Me alegro muchísimo. Y qué bueno que estés disfrutando los resultados de la cirugía. Súper.
Okay, Josie, she says, I'm so excited to see you, Dr. Vidal, on February the 7th.
Awesome. That's 1 month, so it's coming up very, very soon.
If I do transfer to the hip dips with a tummy tuck, how do I sit?
You can sit because the area of fat transfer is not going to be on the dependent portion. So when you sit, the areas of fat transfer are going to be protected. So you can sit after the fat transfer to the hips. That's completely okay.
I'm thinking of adding breast augmentation to my procedure in the spring. How do you determine the size and profile of the implant for each patient? I have no clue what size would look good on me.
No, that's a great question. Very common question. I determine it based on your measurements. When I examine you in person, I examine the amount of breast tissue that you have, the thickness of your skin, the width of your chest, and then having some wish pics for breast, especially breast augmentation, helps a lot to determine what profile would fit best for you. So there is high profile, which is a very round implant. It's going to give you a more augmented, unnatural look. And there's a moderate profile. It's going to give you some fullness with more of a teardrop or a little bit more fullness in the bottom and not at the top. So all those things are things that we are going to discuss in the consult. And the implants I pick or we pick together, I order the day before so they're ready for you on day of surgery.
How do you determine if you can have drainless tummy tuck?
So drainless tummy tuck, I don't perform drainless tummy tucks. Dr. Wigrid, which is my associate here at Pure Plastic Surgery, he specializes in them. But I believe that you have to be in a BMI range and have other medical conditions to qualify to have a drainless tummy tuck. But if you're interested, ask a coordinator so they can guide you and decide if that's something that you are candidate for.
Okay, then another question. Para un BBL, ¿ustedes doctores pueden hacer algo muy notable o hay restricciones de cuánta grasa se puede inyectar?
So, muy buena pregunta. No hay límite en cuánto yo puedo inyectar, pero el límite me lo da tu cuerpo, básicamente. Cuando estoy inyectando grasa, todo depende de cómo tu piel se expanda para buscar la forma que estamos buscando, que no sea algo que no sea bien cuadrado o los glúteos muy altos, que sea algo que vaya con tu cuerpo. Así que es más tu cuerpo lo que me limita cuánto puedo expandir. Sí hay un límite de cuánta grasa puedo remover aquí en el estado de la Florida y es por eso que tengo límites de índice de masa corporal o el BMI para pacientes, porque nada más puedo remover 4 litros de grasa. ¿Por qué? Porque estoy en un centro quirúrgico basado en una oficina y tú te vas de alta ese mismo día. So, no es seguro remover tantos litros de grasa y que usted se vaya para su casa porque pueden haber complicaciones. Así que se hace para mantener a las pacientes seguras. La mayoría de mis pacientes con los índices de masa corporal que yo requiero, 4 litros es suficiente para darte una forma y para tener un resultado muy bien, pero la mayoría no puedo transferir los 2 litros porque la piel simplemente no me lo permite, porque no expande lo suficiente.
Okay, is labiaplasty done under general anesthesia or local? If it's local, do you ask for the same clearance from a PCP?
So labiaplasty surgery can be done under local or under general. It's more of a personal preference. If you want to do it under local, you have to tolerate the pinching of the anesthesia needle in that area. So it may be a little uncomfortable, okay? So that's why the majority of my patients choose to have it under anesthesia. There is a clearance process, but it's not as robust as if you're doing under local versus general, but there is some clearance process involved regarding blood work and stuff. So it depends on the type of anesthesia, of course, and depending on which one you decide, we can tell you what are the things that you need to submit prior to surgery. Okay, thank you so much, you guys. We started in 2025. What?
Happy New Year.
Willie's it's reminding me to say Happy New Year. Yes, Happy New Year.
Until February. It's a Happy New Year until February.
Yeah, until February. So thank you so much for all the questions. Great questions. I'll see you guys next week on the next Tuesday Tips. Take care.